Thanks very much, Cathaoirleach, and I just want to thank all the members for their very helpful and supportive contributions. I was more hopeful at the beginning than I am at the end, Minister, I have to say, when I heard your speech, but this was an attempt to put a spotlight on the situation in relation to Respite and the dreadful situation on the ground, really, and the inconsistency from county to county. And Deputy Sherlock talked about recruitment issues, and I agree with him. But I think there's a bigger fundamental problem, that there's no recognition of the essential nature of the service provided by Respite. It's simply not there, Minister. 3% of the budget goes to it. And so we have now, I'm going to go to Galway and be parochial to illustrate the point. I'm now receiving texts in relation to somebody in Galway on an ongoing basis, the details of which I won't go into. And there are no respite services for that family in Merlin Park, a hospital that sits on 150 acres, absolutely lots of space, lots of buildings, and they've 6 respite beds in a city the size of Galway. 6. I've just been informed that Carrow has no respite beds. I knew that, but it will have no respite beds for some plan to move them all into Merlin Park in the future. We're talking about a huge county here, and we're talking about the Irish language as well. So I brought a motion today to try and put a spotlight, and I thank all the TDs for their support. And in putting that spotlight on it, let me just say the lovely words in the speech that you've now concluded with, and the reality on the ground. All respite was cancelled. We've all acknowledged that in March 2020 due to the pandemic. This is a reply now. Infection and prevention control requirements meant that respite could not continue to be provided in some units post-pandemic. We don't know how many units. This was a question in relation to Galway. Waiting lists were not maintained. So now waiting lists were not maintained, so we don't know who's waiting. And then we're told respite is prioritised based on need and date of application from the clinical practitioner since the beginning of 22. So no waiting list now, they were cancelled. 6 beds in Merlin Park. So no matter what a clinician says, there are no respite beds available. And then if we look at that in context of an answer I got in October 2021, a breakdown of the waiting list for 3 agencies in Galway, 94 adults. Now, this is October 21. 94 adults were waiting over 4 years for respite. 36 were waiting 2 to 3 years. 31 were waiting 18 to 24 months. Between another 2 agencies, 19 children were waiting over 4 years for respite. 11 were waiting 2 to 3 years, and 6 were waiting 12 to 18 months. Now, earlier on, I made a decision not to go into the minutiae, and I'm ending up by going into the minutiae because of the overall sort of spin that comes out from the department in relation, and through ministers, in relation to what's happening on the ground. We have a serious difficulty with the absence of respite beds, and an equally serious difficulty in the spin around that. And I'm only using Galway. I don't mean to be parochial in any way. It's a motion to asking for an audit for the whole country. And you give us figures in thousands of hours provided respite, which mean nothing. It means nothing to the person who can't get respite in Galway in July for 1 week, notwithstanding that they're caring around the clock 24 hours. Now, Minister, I don't expect you to answer me here on the floor of the Dáil, but at least to recognise why this motion was necessary. And what it asked for was one basic thing: an audit. Carry out an urgent audit of what services are available to see are they meeting the need, not to mention the unmet need that has been clearly set out. In the capacity review that I've referred to, that's along with the health service capacity review back in 18, that said it was unsustainable for the hospitals to go on the way they were going on. We needed community care. That's what Sláinte Care says. One tiny part of that is respite. And yet I'm reading out horrific waiting lists in Galway City, and a Merlin Park with 6 beds, and a promise of 13 sometime in August, sometime in July, depending on staff, depending on who the person is answering it. So my motion, and I notice and accept that the government is not going against it, and that Minister Butler said she was very open to doing an audit in relation to her area. She was also going to speak to the Minister for Health and the Minister for Rabbit in relation to the overall audit. To me, it's the most basic ingredient before we can have a planned service. And it's also a step towards honesty, a step towards recognising that respite care, we're not providing it. I also asked in the motion that we look at rented buildings, because to me it's money going astray. And this has been repeated by not just me, but the agencies in Galway, the service providers, who are spending millions on rent to provide respite amongst other services, with no security of tenure and a complete waste of money because of the government's approach to capital projects as opposed to revenue and rental projects. And finally, in relation to the protocol and the optional protocol, we need a date. I realise that certain ingredients have to be sort of put into the mix first, and we're working on those ingredients. But we need a date in relation to signing the optional protocol if we're seriously committed to planning and giving services on a human rights basis.
Thank you very much.